Let's review the posterior arm muscles and look at their similarities. First major similarities is that they all extend the wrist, right? They are posterior to the wrist joint, so based on their line of pull, they are wrist extensors. Second similarity, all of them radial nerve innervation. All right, even the extensor carpi ulnaris, radial nerve. And then the third similarity is they all share the attachment point of the lateral epicondyle of the humerus. So we know we're at the lateral side here because we're on the thumb side. We look up here, all of these extensor muscles are coming to the lateral epicondyle. The distal attachment point is based typically on the name of the muscle. So here in blue, you see this is the extensor digiti minimi. So it comes all the way down here to the pinky. Extend your pinky or your minimi digit. All right, and then I just want to highlight two differences. Go to another difference, or some things to identify. We have in blue here is the extensor carpi radialis brevis. Okay, so obviously it's an extensor. And it also radially deviates because it's on the thumb side. And then note this muscle that comes a little bit longer and goes up on the supracondylar ridge. That is the extensor carpi radialis longus. Okay, one thing to note is here in blue we have the extensor carpi radialis brevis. It's brevis because it just goes up to this attachment point. Then right next to it, going up on the supracondylar ridge, is the extensor carpi radialis longus. So longus is longer because it has a more proximal attachment point, and then you have the brevis here. Both extend the wrist, and both are radial deviators because they are on the thumb side. Another thing to identify, the arm is 3D. Remember, it's not just anterior and posterior. We are three-dimensional. So here we're looking kind of at the posterior side. Here's your lateral epicondyle because you're on the thumb side. And the muscle in blue is your extensor carpi ulnaris because it's coming down on the pinky side or the ulna side. And right here, you can see the flexor carpi ulnaris. Right, so this is coming off the lateral epicondyle, this is coming off the medial. You kind of see both on the posterior side, but one is the extensor and one is the flexor carpi ulnaris. Both of those are ulnar deviators. Hope that helps.